Thank you very much.
I've been bandaged to the side of this page.
Please be seated. Thank you. A quick round of applause, though, for Isaac Wilson over here on the strings.
There you go.
Back by popular demand, I hear. That was great. Wonderful. You do parties, Isaac? Do parties? Do parties? Okay. Okay, great. Well, good afternoon, everybody. Welcome to our Safe Kids, Strong Families Child Welfare event. Today, we're going to speak a little bit about where we've been, some of the successes we've had over time, and then look a little bit to the future at opportunities going forward. My name is Justin Hagen. I am a Deputy Chief of Staff for the Governor here in Richmond. I'm personally here, though, because I'm highly interested in this topic as a foster parent myself. A good 10 years or so ago, my wife and I were sitting around the kitchen table. Life was going great, as good as it could be at the time. We had good jobs, we had a couple of lovely kids. They were thriving, or at least thriving as much as two kids at 4 and 2 could be thriving. But we noticed, we came from pretty humble beginnings. These kids are so spoiled. They've got so much more than we had when we were kids, and we got so much more than so many kids around the state of Virginia, especially the foster kids that we had interacted with in the past. So we started looking into the idea of becoming foster parents ourselves, with the encouragement of our local church, others in our community, some in our family, not everybody in our family, but some in our family were encouraging. We went through the process of becoming certified foster parents, which took a while. It was a very rewarding experience, but it was a difficult one for sure. Not too long after, though, we got that call. So many foster parents know this call. You get a call in the middle of the night, in the middle of nowhere, and they say, hey, we've got a couple of kids. Can you take them? And it's impossible to say no. So very quickly, we doubled the family workload, went from 2 little girls to 4 little girls, all under the age of 5, which, saying out loud right now, sounds a little nutty, but it sounded like a good idea at the time. But then there's a sad day that occasionally comes. The sad day was the call that came and said, these girls are moving on. That's a very tough thing to undergo. In our particular case, it was a great day because these kids were going through what most kids in the foster care system should go through, reunification with their birth mother. It wasn't easy for us to let them go, knowing where they might be going back to where they started, which wasn't necessarily a great place. But we were also extremely fortunate that we developed a strong relationship with that birth mother, which allowed us to continue being co-parents, if you will, with those 2 little girls, which we still are today. They call me Theo Justin, Uncle Justin, not just the 2 little girls, but now the 3rd addition to the family, who is my goddaughter. So I essentially have 5 little girls. Please pray for me. Along the way, you kind of experience and get to see the inside action, how things really work, and you realize there's so many hurdles, so many opportunities for improvement. There's these saints that are the social workers doing God's work and going out there and just doing everything they can, but they're so limited by resources that they can't provide everything that they want to, and it's just difficult in general. So when I had the opportunity to join this administration, I was super excited because I knew that this was a priority of Governor Youngkin. I saw that under the leadership of former Secretary of Health John Littell and current Secretary of Health Janet Kelly, that this is a priority of this administration to improve child welfare outcomes and circumstances. So it's exciting to be here today to be able to join, see what work has been done, and especially see what more we can do to help improve those outcomes for people. To kick off this discussion today, though, I want to introduce someone who I think I can say is one of the state's staunchest advocates for child welfare improvements. As a child of adoption, I'm going to read some of this because she has an amazing background. I want to be sure I get it right. As a child of adoption, few know the system better than she does. She was raised in Suffolk by a family of small business owners. She knows the value of hard work, therefore. She knows how to pick herself up by the bootstraps, how to start a business of her own. She actually started a successful business of her own. And she took all these skills and applied them to her passion for giving back, which led her to become a delegate representing the 64th District in Virginia, and now is a state senator representing the 17th. As part of her service, she has worked tirelessly to reform and improve the adoption and foster care systems, something we are all grateful for. Ladies and gentlemen, Senator Emily Jordan.
Thank you very much. I appreciate that. Wow, what a nice introduction. Thank you. First, it's an honor to be here today in the holiday season. For those that celebrate Hanukkah, Happy Hanukkah. For those that celebrate Christmas, Merry Christmas. But I want to take today to really talk about really the monumental crossroads that we are at today. Just reflect on a simple goal that started several years back. All we want to do is keep children safe and supporting families and caregivers in that mission. But we have to kind of talk about how do we get there. So many years ago, there were several reports that indicated our Commonwealth needed to do more to fill the gaps for children in need that seemed to be falling through the cracks of a system that was just broken. Many legislators, including myself, decided that children and their safety was never going to be a partisan topic, as it never should be, and we just dug in to get to work. After all, we know that everybody in this room, because we know you're here because you care, our number one goal is making sure that children and their welfare and their families are supported and safe, and we need to make sure we make a pathway to get there. So I know so many of you here are here because that is your number one mission, so thank you. I also want to thank the press today that joined us. I don't know how many, raise your hand if you're press. Anybody? Everybody? Thank you guys. I want to tell you why. I said the same thing a couple of years ago when we formed the Foster Care Caucus, so I'm going to say to you today. The words that you write and how you highlight the programs that we're going to talk about today could make the difference of a child sleeping in a warm, safe bed or eating a hot meal. Don't forget that you have a platform. Please use it. In 2019, the Foster Care Caucus came together. We talked about an omnibus bill that stemmed from the JLARC report. Does everybody remember that report? Raise your hands. Does everybody remember how awful that report was? Nod your head, yes, please. We talked about how we needed to go from that moment and where we were going to go going forward from that. We decided, after that alarming JLARC report, we were going to outline steps to get to success. But we're not done yet. There's so much more to be done. Part of that charge was a total overhaul of the foster care and adoption process in Virginia, which was one of the many things I undertook. My friend Senator Reeves made sure the first thing he did was expand eligibility for home studies inspectors, i.e. teachers, retired law enforcement, retired social service executives, nurses, anybody in the system who had an opportunity to work with children. We were going to utilize that platform to be able to allow those people to speed up approvals and reduce the backlog for foster and adoptive parents, and we did. Myself, along with Senator Favola, who's not here today, who's been a longtime champion of children, worked on implementing the Kinship Guardianship Assistance Act in the hopes that children would get to live out their lives with their next of kin and divert from the foster care system, improving outcomes, especially educationally, physically, and socially, because we know unfamiliar surroundings really can affect a child's traumatic experience when they're going through that process. But we know familiar surroundings allow children to have continuity and safety, and so therefore we did that. 24, after many years of studies from the Commission on Youth, I see my friends here today, House Bill 27, Senate Bill 39 passed the 2024 General Assembly, which created a standardized process to prioritize safe, temporary kinship for placements and reducing children's entry into foster care, called the Parental Child Safety Placement Program. Well, we talk about all these names and titles and programs. We're going to talk a little bit about the statistics because children really aren't statistics, but it's important for those that are writing about it to know why it matters. We all know we wanted to fix things very quickly, and we wanted to move at hyper speed, but everything that we do means that somebody has to implement it. I'm looking at Carl, and I know we've done a lot, and thank you for keeping up with us and doing everything you can. We appreciate you. We know this, though. 816 kinship waivers were submitted, resulting in the placement of 1,401 youth in kinship foster care homes. What a remarkable number, and that deserves a round of applause. With that, though, we know that action always comes with increased oversight. The Office of the Children's Ombudsman was stood up and launched with full operations in May of 22 to protect foster care youth and children serviced by the child welfare system. Let me tell you, they've already done remarkable work. In 25, Governor Youngkin, thank you, signed bipartisan legislation, House Bill 1777 and Senate Bill 1406 from Delegate Sullivan and Senator Salim, which strengthened Virginia child's welfare system by empowering foster care youth. It mandated local departments provide each and every child of age in the foster care system would receive the information from the Office of Children Ombudsman, so that way they needed help, they had a lifeline to reach out to. After the JLARC report, we knew that wasn't happening, and this provides those children a lifeline and a direct connect for advocacy in the position that they're in. It empowered children, and we're very grateful for that. The governor and Secretary Kelly, thank you for standing shoulder to shoulder when they discovered the high incidence of children sleeping in local social service offices or hotels, and immediately launched the Safe and Sound Task Force in April of 22. I cannot tell you what that means to me. The Safe and Sound work that they have done reduced the number of children sleeping in local social service offices by 89%, turning what had been common into a rare exception. Now, I want to stop and say thank you to the social service workers because they are doing everything that they can to make sure that children have a safe space. So while they dealt with backlogs, thank you for coming to their rescue. This administration established Virginia's first of its kind statewide kinship system to prioritize family placements, expand support for kinship, foster care, and adoptive families with trauma-informed care and training. We cannot pretend that trauma doesn't exist when children are removed from their homes. But what we can do is choose how to respond to it. It is estimated that 90% of foster care entries are directly linked to parental substance abuse and mental health needs. We all know that, but hearing it is really an astounding number. So, integration with the governor's Right Help Right Now initiative seemed like the right choice. Making sure that we have behavioral health plans and the right direction to get additional resources for parents is so very key. Making sure that we unite families stronger and better together is the most important initiative. Governor, thank you for Right Help Right Now. We're very thankful for your work there. Thank you so much. The bottom line, Safe and Sound, has improved outcomes for high needs youth and their families. One of the things that we also found in the gaps in the system was their access to health care. When children entered the system before, mental health was a priority need, but it wasn't a priority at the time. There were gaps in services for those entering care, and we decided to embark as a team on a monumental change. Cardinal care was implemented to make sure that as children entered care, they had access to behavioral health, mental health, and health care needs and services. Thank you all for your work on that to make sure that when children are going through a system, it is seamless, even in their hardship. I would say this, the bottom line really and truly is, Virginia's moved mountains over the last several years to ensure that the Commonwealth's most vulnerable youth are supported, strengthened, and cared for. From the integration of Safe and Sound, to healthy moms, healthy families, and healthy communities, to the work with Right Help Right Now and the integration of that system. But Virginia is no longer lagging, we're leading, but the work is always far from over, and that's why you're all sitting here today. Before I introduce our next speaker, though, I just want to say thank you for all of your work, everyone on the stage and everyone in this audience, for caring about children first. I know it's not always a top-of-mind topic for some people. I think they would always like to talk about the 3% issues, but this is the core value that really matters. For our friends, community partners, leaders, and our press friends, I see you, Dave. Just remember this, I want to leave you with one charge. The voice of the voiceless are only amplified and implemented by the charge of those with ink, power, and pen. Let's not forget that. With that, I would like to introduce Melvin Roy. Melvin spent 6 years of his childhood in a foster care system. He was 13 when he was placed in foster care. And after the initial shock began to wear off, he saw an opportunity to improve his life and the lives of others. He worked for Project Life in high school. Wow, already working young. That's great work. A partnership with VDSS aimed helping older foster care youth successfully transition out of foster care, and founded Foster U as an undergraduate at Old Dominion University. He continues his work as the founder of Foster U, an organization aimed at encouraging youth in foster care to access higher education. Our next speaker, I'd love to introduce Mr. Melvin Roy. Thank you for the
Good afternoon, Governor, Secretary, and partners. Thank you for the opportunity to be here and for your continued commitment to families across the Commonwealth. My name is Melvin Roy, and I stand before you today not only as a professional in child welfare, but as someone who grew up inside the very system we are gathered today to strengthen. I am a product of that system, its intentions, its structure, and its gaps. For much of my childhood, what I felt most acutely was not just instability, but absence. An absence of consistency, an absence of safety, and at times, an absence of love. Not because individuals did not care, but because the system itself was not designed with love at its foundation. When love is missing from a system, children feel it immediately. They feel it in high caseloads that limit connection. They feel it in rushed decisions that prioritize compliance over care. They feel it in systems that manage trauma rather than heal it. And yet, within that same system, I encountered something transformative. I encountered a social worker named Chandler Evans. Chandler did not change my life with grand gestures or sweeping reforms. He changed my life through steadiness, through presence, through care that was consistent, patient, and deeply human. He showed up, he listened, he treated me not as a case, but as a child worthy of dignity and belief. Through him, I learned something essential. When love is present, systems work better. When a child feels seen, safety becomes real, trust becomes possible, and hope begins to take root. That is why, as we talk about system change, I want to be clear: reform cannot be built on policy alone. It must be built on people and on values. We must design a child welfare system that protects time for relationship, invests in the workforce, and values emotional labor as essential infrastructure. We must pay, support, and retain social workers, not simply because they are needed, but because their work is so sacred. Love should not be the exception carried by extraordinary individuals. It must be the standard embedded into how the system operates. Because when love becomes foundational, children do more than survive. They heal, they grow, they lead. I am standing here today because one social worker led with love, and because God carried me through every step to this moment. My hope is that together we build a system where love is not accidental, but intentional, protected, and permanent. Thank you. I now am going to introduce you all to Lacey Radford, who is the Youth Development Coordinator at Shine Forth. She joined formerly UMFS, but now Shine Forth in 2023. Before that, she worked with the Virginia Department of Social Services as an Education and Training Administrative Specialist, or ETV for short. Drawing from her own lived experience in foster care, Lacey is deeply passionate about empowering youth. She is a Germanna Community College graduate, and plans to pursue a bachelor's in human services and a master's in social work. So without further ado, I introduce you to Lacey.
Hi, everybody. It is an honor to be standing in front of you today. This is a huge opportunity for me. As Melvin said, I'm Lacey Radford. I am the Youth Development Coordinator with Project Life under Shine Forth, which is formerly UMFS. If you guys remember, we had a rebrand. On top of my professional experience in child welfare, I do have lived experience. I entered care at 15, ultimately aging out at 21 from the system. So upon being a lived experience youth and now a professional in child welfare, I've seen so much about the system that needs to be improved. I think we really need to focus on allowing our older youth more space at the table to be heard and to share what they think should happen with their life. We cannot expect youth to go along with whatever goals or plans you put in place without consulting them first on what they really want to do with their life and a better understanding of how hard it can be for youth aging out of care. There are youth out there that think they're ready. I was one of them. I knew how to take care of myself. I knew how to pay my bills. I knew how to make doctor's appointments and all of those things. But what a lot of people didn't realize, myself included, that there was a deep loneliness that comes with aging out. When you had in my experience, when you have good social workers like I did, I had people that were always there for me, whether they were being paid to or not. And then all of a sudden I aged out and that all kind of went out the window. Who was I supposed to go to when I needed help? So that really affected me aging out of care. I struggled with my mental health a little bit and stumbled within my work in the professional field upon aging out. But because my Project Life team and the supports like my social worker still wrapped around me, I am able to stand here and speak to you guys today. I will share a story that's kind of near and dear to my heart. It talks about my experience coming into care, and it really focuses on child safety for me. I had lived with extended family from the age of 4 until I left to come into foster care from them. And it was not the easiest experience. I had dealt with some abuse. I did try to speak up about it. I told teachers and counselors at school that it just wasn't right. I didn't have a word for what was going on because I was so young. But I knew it wasn't normal and it wasn't right. But no one did anything. No one reported it. No one investigated. So I was left in the home until I was 15, where the abuse had gotten worse. And ultimately a lot worse. I could not deal with it anymore. I had gone to social services and demanded that I be removed from my home for my safety because I had reached a very dark place and I just did not see an out. No child should have to ask or even demand to be removed from their home due to safety reasons. That is the adults and the social worker's job to decide, not the children's. And then the good thing I wanted to share was my experience with my social worker prior to aging out of care. I had gone through a handful of social workers before meeting Allie Reynolds. I was very turned off to the idea of social workers at this point. They just seemed to come and go without a care in the world. So there was no trust there for me to introduce or even allow them into my life. But Allie, she tried. No matter how hard I pushed her away, how hard, no, I don't need you, I don't want to talk to you, she still tried. She still reached out. She supported me through my big life events, and she just kept trying. She was there for everything for me, no matter what. So now even after I've aged out, she's the first person I call. She was someone who was at every graduation. She is a big part of my life. She is my son's aunt, that's what we call her. She will be hanging out with us tomorrow to celebrate my son's first birthday, as well as she supported me a lot postpartum and in pregnancy. And I share all of that to share that good social workers can make or break a youth's experience and their success upon aging out of care. Social workers do so much hard work, whether it be the physical hard work or even the emotional hard work. A lot of these youth have trauma, as it was shared up here before, that isn't always recognized. We need to help them heal from this instead of trying to just manage it. So if we have good social workers, you will have more youth in spaces like this that will be confident to share their experiences and their stories with you. If I had not had Allie, who pushed me outside of my comfort zone, who encouraged me to take every opportunity presented to me, and then just believed and cheered for me louder than anyone else, I would not have the opportunity to be sharing my story with you all today. So for Allie, and then just being here, I thank all of you. And now it is my honor to introduce a person who I think is pretty amazing, who holds child welfare near and dear to her heart, who is a foster to adopt mom herself and works tirelessly to improve the lives of youth in Virginia, the Secretary of Health and Human Resources, Janet Kelly.
Perfect. Well, good afternoon. Thank you so much for having me. And Raphael, I'm going to risk moving this up a little bit because our next speaker is even taller than I am. Is that okay? All right. Well, good afternoon. Thank you so much for being here. Thank you, Justin, for sharing your story, Melvin, for moving my heart, and Lacey for just making me even more motivated today. I really appreciate it. And Isaac, of course, back by popular demand. How many of you really want to see Isaac on an even bigger stage one day? I know I do. Thank you all for braving the cold. I think that's symbolic of how much you all give every day, regardless of how inconvenient or uncomfortable it is to show up for kids. I want to do something really quickly. How many of you, I want you to stand up if you have a personal connection, not a work one yet, a personal connection as a bio family, a foster family, a kinship family, adoptive family, or you were in the system yourself. If you're comfortable standing and are able, can you please stand? Wow. All right, stay standing. Yes, please applause. Stay standing. Stay standing. How many of you also now work in this space? We're going to get everyone in the room who touches this space. Raise your hand, stand if you also work in this space. All right, we did a good job on the invite list is what I'm saying. Well done. Thank you, thank you, thank you. You may be seated. Thank you, Senator Jordan, for taking the time, the history lesson on the foster care system over the last 10 years and all the attempts to improve it and fight for kids. And of course, Governor Youngkin, from day one, you recognized this need, but you also jumped into action. It wasn't just talk. You knew that Virginia could only be the best place to live, work, and raise a family to the extent that her children had the opportunity to reach their God-given potential. Thank you so much. Before I jump in to cover the 6 pillars of this report, which I get the privilege of doing, so it's going to be a ride. You got to hold on with me. There's one more person I'd like to thank. My husband, Ryan, is here today. And for those of you who know my family's story, you know that he is actually the one that got us into it. This life is not our lived experience. We just call it life. We have 3 kids now, and his work is, you're not supposed to make me cry. His work is just as important as mine, and some days more important, but he continually sacrifices to support us and our family, so thank you. Can we please give a round of applause for Ryan? Thank you. All right, it's all downhill from here. What we've achieved together in only 4 years is truly unprecedented. As I was listening to Senator Jordan talk, so much of what was done before this administration is amazing, and we have done more in the last 4 years than I think we have done in the last 20. If you really look at year 1 with Safe and Sound, and year 2 with Right Help Right Now, and year 3 with the kinship program, and now in year 4, this exciting new initiative that will live beyond us. We did all of this in a strong bipartisan way. And I'm just really, really pleased with the results of this report. I'm going to walk you through the 6 pillars. You're going to notice a lot of similarities to the Right Help Right Now plan. And then we're going to hear from the governor on exactly how this is going to work. So this spring, under the leadership of the Virginia Department of Social Services, alongside the local Department of Social Services, other state agencies, over 280 stakeholders, and dozens more people from the community who just showed up and said, I want to help. We engaged in workshops, design sessions, and direct interviews to make sure that we were covering all the diverse perspectives. In addition to a landscape analysis of over 27 states, we were able to determine some really great best practices and innovations in child welfare. These efforts have resulted in this report that I'm going to go through with you today and will be found on our website after this event. This intentional collaboration produced this 3-year child welfare strategy that directly responds to gaps in child safety, workforce, accountability, permanency, access to prevention, and behavioral health services. Now, nothing in this plan is surprising or shocking. Like Senator Jordan mentioned, there was a JLARC report a decade ago. There have been other reports, even older. There have been reports since then. We all know the right thing to do, but what we hope out of this report is exactly what happened with Right Help Right Now, which is it will not just sit on a shelf. It will live in the hearts and minds of Virginians long after we are gone. Like Right Help Right Now, it has 6 pillars, which should be behind me, good. Like Right Help Right Now, it provides a clear roadmap for those of you who will be here in 32 days to move it forward. This transformational framework rests on 6 pillars, which you can read behind me, and I'm going to go through each one very briefly, a minute each. So again, hang on. Pillar 1 will foster a strong and consistent child welfare workforce. Many of you taught me that child welfare workers are the first responders to the human condition. These frontline workers carry some of the most challenging responsibilities in public service. Every day, they make life-altering decisions that affect the lives of children and families. They see more hard things in a day than most of us will see in our entire lives. And sometimes it can feel like they are holding the entire system together by the sheer force of their will. I'm not at all surprised to hear Lacey and Melvin each list one person who is the difference maker in their lives. Both of them listed their social worker, Chandler and Allie. To all of the Chandler and Allies out there, thank you so much for loving the kids in care as if they are your own. And can we please give them a round of applause? As a token of our appreciation today, each of you has received a card to write a generic thank you note, and we'll make sure to get it to one of those frontline workers. This work, though, takes a toll both personally and professionally. Family services specialists have a turnover rate of 44% every year. Do the math. And vacancy rates at 67% at some local Department of Social Services offices. The governor will talk more in depth about this pillar in just a minute. Pillar 2 will bolster our child protective services efforts and increase safety for our children. Carl, I hope it's okay if I share that the worst part of my week is every week when Carl walks me through the news reports. I asked him about a year ago to talk through with me the headlines. Do you know what it takes to get a child in danger from being in danger all the way to making a headline? It's a terrible process. But we started walking through this about a year ago, and I will just say that far too many of those kids had social services impact and touching before their incident that got them in the news, and most of these, I think, were highly preventable. Virginia follows the national trend where there is a disproportionate amount of vulnerability of young children under the age of 3. Nationally, 60% of child fatalities are 3 years or younger, and 44% are younger than 12 months. We're also seeing our ability to respond to child abuse hotline calls remain static while experiencing a 10% year-over-year increase in the number of calls coming into the system. So, a static number being able to be responded to, an increase in the number of calls coming in. Virginia screens out a larger proportion than the national average. The consequences of our current reality are grim, as I just said. I urge you to read the Children's Ombudsman report on child safety as well, and Governor Youngkin will talk more about this pillar in his remarks too. Pillar 3 focuses on achieving better permanency for youth. Currently, Virginia ranks 50th in the nation for permanency for children aging out of foster care. And what that means is a place to belong. It's what Lacey talked about in her remarks. Who do you call when you turn 18 and you have a flat tire? When you found the guy that you want to talk to someone about? When you have a job interview and you need someone to help you prepare? That's what permanency means in typical person language, even though it's a child welfare term. Our kinship system that is newly created will help, ensuring that fewer kids enter foster care in the first place, while ensuring that children have those grandparents, aunties, uncles, teachers, coaches, and other family friends to ensure safety and belonging, while their biological parents get the support that they need. Pillar 4 will integrate the governor's transformational behavioral health plan, called Right Help Right Now, into the child welfare system. Let me tell you why this is important. An estimated 60 to 80% of kids enter the child welfare system due to abuse and neglect that is caused by their parents' substance use or mental illness. So you can see the relationship between the two. Now let's talk about the kids. Nationally, children in foster care are 4 times more likely to be diagnosed with behavioral health conditions. In Virginia, children in foster care are 2.5 times more likely to be prescribed psychotropic medication. Children in foster care, fortunately though, receive now behavioral health resources at a higher rate than the general population because they need them. Infants who are born substance exposed are of a particular concern. We are, as of today, actively exploring pilots with willing local social services agencies to ensure that all families who have substance-exposed newborns are getting the full benefit of the intersection between Right Help Right Now and Safe Kids Strong Families. In fact, our senior advisor to the governor for Right Help Right Now, Dr. Alexis Aplaska, who would be here today, except she's on maternity leave herself, recently moved to DSS as the director of the Office of Clinical Health and Family Wellbeing and will be taking lead on this project. We can ensure that babies are safe and ensure their parents are getting the treatment that they need. Pillar 5 will enhance the prevention of kids coming into care and increase family preservation. Keeping kids safe in their families and in the communities is the foundation of a responsive child welfare system. It's why we created the first of its kind kinship program last year, and it's why in 2018, Congress passed the Families First Prevention Services Act to accomplish this goal. It's also why then Senator Bill Mims, who is here with us today, introduced legislation, it was so long ago we couldn't remember the year, and eventually spearheaded an attorney general's opinion saying that parents did not have to give up custody of their kids to get critical mental health services. 7 years later, on Families First, the jury is still out on implementation, but here's what we know. Virginia draws down less federal funding for prevention than other states. Therefore, it is not surprising that 77% of caseworkers think that there are insufficient services in the community to keep children in their homes. Bottom line, families should not have to enter the child welfare system to get the services, and there is a lot of opportunity to leverage federal funding here. Lastly, y'all still with me? All right. Pillar 6 will modernize oversight and infrastructure in our child welfare system. So let's circle back to Pillar 1. The number one reason that child welfare workers say that they leave their jobs, why we have a 40% turnover rate, why we have a 67% or 67% vacancy rate, is that they feel like they cannot be successful in their roles. We simply need to do more to set up our child welfare system for success. We knew that this was going to be a challenge when we started Safe Kids Strong Families, but the data that came back when we were compared with other states was stark. Virginia has nearly 2 times the total number of local departments than the average state supervised, locally administered system. So let me just break that down in English. Virginia is a state supervised, thank you, locally administered system. Okay, we've got 120 local agencies who do the same thing. Most of the time, they do it very well, and they work very hard. But I'm not sure that they're set up for success. There's also a substantial amount of variation in performance among these local agencies. The average in another state is 66. So we have almost 2 times more than the next state. We oversee more local agencies in total and by region than any other state supervised locally administered system. So when you're thinking through this, and I've been in and out of politics for public service for 25 years in Virginia, and there's a fun joke that applies to this that I hope you will go with me on the punchline. It's how many Virginians does it take to change a light bulb? And the punchline is change. Human beings are notorious for not wanting to change, especially when it comes to releasing something we care deeply about. It's what makes us humans. But we have to start thinking differently. Based on the data in this report, we can continue to wait until even more drastic things happen before we change and be reactive, or we can use Safe Kids Strong Families as a conversation starter to develop a proactive, collaborative way to keep kids safe and families strong. Using these pillars, Safe Kids Strong Families has identified some initiatives that the governor will now highlight. Let me say before he comes to the podium that the funds to invest in our priorities this year with his outgoing budget were more limited than in previous years. But this initiative and these kids got the vast majority of that funding. With that, I'd like to introduce someone who will always work to keep kids safe and families strong. Please join me in welcoming Governor Glenn Youngkin.
Well, good afternoon, everyone. Thank you. Thank you all for joining us again at a moment where we have a next step to take. A next step that is critical to the future of the Commonwealth because it's all about our children and families. A next step because we have been building for the last 4 years this very, very important foundation to support children and to support families. And therefore today, while it is a big step, is going to require more than us. It's going to require all of you. It's going to require the next administration. It's going to require our General Assembly members. And most importantly, it's going to require teamwork. And that, my friends, as my friend Lee Jackson says frequently, is the dream work. So first of all, Secretary Kelly, thank you for your leadership. Thank you for reminding us every single day that we do not run away from difficult problems, we run to them. Thank you for reminding us each and every day that when we run to them, we come up with a plan and we then solve them. And that is the commitment that you hear from all of us today, especially when it comes to finding solutions for our children. Safe kids and strong families is at its core the future of the Commonwealth. Safe kids and strong families. Because we have been blessed with amazing, amazing attributes. We have seen Virginia grow jobs faster than she ever has. We've seen economic commitments come greater than the last 6 administrations. We've seen budget surplus after budget surplus. We have seen law enforcement heroes that are willing to sacrifice everything in order to keep us safe. We've seen work that has preserved God's natural resources gifts or gifts of natural resources to this Commonwealth like never before. And yet at the end of the day, we need to continue to serve the future, our children. And that's one thing that I believe no one will argue with. All of these tremendous attributes of this amazing Commonwealth allow us to do the continued work that we must do. They allow us to divert and direct resources where it must go. They allow us to bring the capabilities, the professionals to support these children. And most importantly, they obligate us to do this across the entire Commonwealth. You see, our welfare system, our child welfare system, is a system that is born out of our love. And yet, as we heard so clearly, oftentimes the system, the processes, the bureaucracy gets in the way. I too have my own family story, because I watched my sister for decades work in the city of Chesapeake child welfare system. She worked in foster care. I watched her work so hard every evening and every weekend. Whenever we'd have family gatherings, there she was on the phone, carrying around manila folders, serving kids, serving families. And I think this system, which is built on heroes, is built on the right thing, people, but we have to unlock these capabilities in a very, very different way. And that's why back in May, we took yet another step that is part of an integrated transformation effort to support kids and families. And you've heard this. We started with Safe and Sound. We started with Safe and Sound because we had an emergency where children were literally sleeping in offices around the Commonwealth of Virginia. I'll never forget when then Senior Advisor Kelly came into my office and said, "Governor, last night's the first night. No children sleeping in offices." There was a cacophony of celebration around Patrick Henry. That's what it took. It took a hero, an enormous amount of work in order to make change. We stood strong together for building blocks for Virginia families. How do we overhaul child care and early education to support those families that need help in order to provide that early education experience and that child care that unlocks opportunity both for parents and, of course, for these children? I'll never forget the look in the eyes of the sponsoring legislators and all the advocates when kinship care went from an aspiration to a bill, to a law, to a new system. I was always reminded of the grandmother that I met in Lynchburg in a parking lot during the campaign. I was standing in front of the Texas Tea Room. I saw her standing in the parking lot, and I went out to see her, and I said, "Ma'am, are you okay?" And she was in tears, and she said, "My daughter has really messed up, and she's paying her debt to society, but they're going to take my granddaughter away because grandparents have no status." When we signed that bill, while she wasn't standing with me, I knew she was. That, my friends, is strengthening families. The work through Right Help right now has been truly transformational, and it will continue. And it stretches into every avenue of what we're talking about today, which is how do we make sure that the services that are needed when Virginians are suffering oftentimes their very worst day are available right now. The right help right now. Healthy moms and healthy babies and healthy communities gets right at the core. When a mother who is concerned about her ability to carry a child has confidence that that child will be healthy, confidence in her own health. I will say the reduction of our maternal mortality rate by 70% during this administration is something we should all be incredibly proud of. Unfortunately, we still have work to do because there are still moms who suffer. There are still moms who pass away, and that's work that will never end. And so we find ourselves in this next chapter together, which is safe kids. Safe kids and healthy families. The most powerful words in the English language are "I love you," without a doubt. Nothing comes close, although I like "you are hired." Nothing comes close to "I love you." I love you changes everything. I love you means I see you. I love you means I care about your future. I love you means I'm with you. And you can only imagine a child who wants nothing else than to hear those words. Nothing else than to know that they're safe. And nothing else than to know their family is strong. Whether that is their biological family or whether that is an incredibly gracious one who opens their home. That is what "I love you" is all about. And so today we take a big step. Today we take yet another step in transforming an area of the Commonwealth that needs to be transformed. And I use these words so frequently, and I hope they don't become numb in your ears. When there is a system that isn't working, no single bill, no single program, no single person can change it. We have to collectively do this in a way that does bring full change. Yes, Virginians can change that light bulb, Madam Secretary, but it takes a lot of us. And when there are a lot of us, amazing things can happen. The leadership of this effort, I just want to highlight once again. The leadership has been amazing. And I just want to thank everyone for leaning in and making sure that we not only see change, but we make it. Secretary Kelly, your vision here has been undeniable. Senator, your passion on everything that we have undertaken has been contagious. I have to say to our General Assembly partners, there has not been a partisan moment. This has been a uniform effort. I want to thank Eric Reynolds. I will say the Office of the Children Ombudsman is special. I remember meeting Eric and the team when I first started, and the work that has gone on here is so critical. And I'm very happy that I was able to include funding to expand the resources in your office. I want to thank Kevin Erskine, who is our Commissioner of Virginia Department of Social Services. Unbelievable. Thank you. The load you've carried over this administration has been huge, from fixing SNAP benefits at a moment when the federal government was shut down by Senate Democrats, to a moment where you believe so deeply in the future of our children that I know that you and, of course, Carl Ayers have given everything you have in order to make this work. Carl, thank you. Let me cover a couple spots here that I think are really important for us as we hit this first phase of transformation. And I want to remind everybody, change does not happen overnight. 3 years into Right Help right now, we are seeing the fulfillment of so many initiatives. Yes, 6 pillars conveniently, but 6 pillars that work simultaneously, but also had to be sequenced with building blocks in place for the next one to come. And we are still seeing huge effort. While we are actually doing ribbon cuttings to open up new facilities, we are doing groundbreakings to open up others. While we are seeing the transformation of workforce, we are now still implementing funding for more scholarship programs for nursing programs around Virginia. The work continues. And so what we'll see over this transformational effort is building blocks put in place to enable the next stage and the next stage and the next stage. And at the end, it will be transformed. But it requires commitment to do so. But we've demonstrated over and over and over again that when we collectively commit to this kinds of transformation, we can move mountains. And that's what's happened in the Commonwealth of Virginia. So let me hit just a couple key elements of these first steps. And much of it does require funding. Funding to support change. And so the budget that I will present on Wednesday will include $50 million of targeted funding to accomplish enabling changes in this system. And let me just highlight a few of them. There's 4. First and foremost, to go back what we've been talking about, the heroes of this system, the heroes that change children's lives, they need to be paid more. And that's the bottom line. And so we will include $10 million in this budget to fund an increase to the salary minimum for local departments, family services employees. Full stop, we're raising pay because they not only deserve it, but also so we can attract so many more people into this noble, noble service. Second, we know that this time of greatest risk is from 0 to 3. And yet there's this old standard that we only pay overtime for priority response for 0 to 2. This one's easy. Change overtime rules for Child Protective Services to give priority response for children all the way up to the age of 3, and don't stop at 2. This is the highest risk stage, and that requires more resources. And let's make sure anyone who is going to work that overtime to support the 3-year-olds gets paid as well. Third, we know that there has to be some incremental oversight at the state level. Because at the state level, what we are finding is that we are unable to put the resources to work to help the teams of local administrators do the job they need to do. And so we're going to support this increased state oversight mechanism so that the local departments can get the help and support they need. It's another $7 million. And finally, the biggest piece. The biggest piece of this is centralizing the Child Protective Services intake system. You see, across this system today, as you've just heard, it's fragmented. And it's fragmented in a way that the initial intake is done in an inconsistent way over the Commonwealth. And therefore, there are drastic differences in that intake process, and therefore, oftentimes, children aren't getting the services that they need. You see, Virginia, as you've just heard, screens out a larger proportion of referrals than the national average. The national average for Child Protective Services referrals to get screened out is 43%. In Virginia, 60% are screened out. Now see, that is not purposeful. It's just that the system is not consistent. And if we have a consistent system with the same standards executed on a centralized basis, it will make sure that the intake of children across the Commonwealth of Virginia is done in a way that then enables our local services to take the needed follow-up actions all the time. This is a big step. And the reason why this is so important is because only 23% of the cases that are determined to be high or very high risk have been opened for in-home services. This translation of intake, consistency, recognition of the need for in-home services, and the delivery of those services has to get better. And that's why we firmly believe that centralizing this piece of the process will lead to substantially better outcomes for our children. A dedicated centralized staff that's trained in uniform standards and protocols, an integration of data analytics and decision support tools to improve consistency and overall decision making, and the ability to route valid referrals efficiently to the appropriate local agency so the work can be done. My friends, this is something we can do. This requires the bulk of our investment at this first stage, and we will see a substantial commitment in my budget of $33 million in order to fund this. This is the start. Change is not easy. Change is not easy. But together, we can fundamentally transform the way that we are serving our children. We talk about outcomes and results. But if we do this right, where we pay people more, where we have better oversight, where we're able to provide the fair overtime support all the way up to 3, and we take this giant step of centralizing intake, we then have the launching off pad to do the rest of our transformation. Therefore, this is critically important for us to get done now. And that's why, as I speak to the General Assembly colleagues on the money committees on Wednesday, they will hear this again from me. It's time for us to take this next step in making sure that our children are safe and that our families are strong. I want to thank everyone for being here. I want to thank you for your passion and your commitment and your love. And together, we can make sure that Virginia is the safest place for kids, and we have the strongest families, and that indeed will make Virginia the very best place to live and work and raise a family. And with that, may I ask God's blessing on each and every one of you as we celebrate this season of light. No matter your faith tradition, it is about light. And when we let light into the room, it chases out the darkness. Merry Christmas to you all, and God bless you. Thank you.